My name is Randy Bigley. Joining me right now on the podcast from the Symphonic Hearing Aid Center is Sonya Keller. Good morning, Sonya.
Good morning, Randy. It's nice to see you again.
Good. The same here. Yeah, we're starting a whole new year, 2023, and good time to if you're thinking about getting a hearing aid or something, it's a good time to look into that, right?
Correct. Actually, one of the things I was going to talk about real quick is beginning of the year, January, people's insurance benefits are renewing. A lot of the Medicare supplements are starting to cover hearing aids, so
Good.
I recommend people take a look at their insurance plans to see if they have a hearing aid benefit. The over-the-counter hearing aids are now legal, so they're selling them at drugstores, but I'm also offering over-the-counter hearing aids at my office, so they're at discounted pricing compared to, regular
Right.
priced hearing aids.
What is the difference between an over-the-counter hearing aid and a one maybe that you regularly carry?
Well, so the over-the-counter ones, I mean, they're allowing like pharmacies to dispense them. Some of them are self-fitting, so that can be difficult for people, meaning that you purchase them and then they're app-based, so they're tied to a smartphone, so that doesn't always apply to everything. And probably the biggest misconception about the over-the-counter is people think that anybody with a hearing loss can just go in and buy a hearing aid that's going to work for them.
Right.
But they're intended for people with mild to moderate hearing loss.
Okay.
So that actually kind of lets a lot of people out, doesn't cover a lot of people in terms of their hearing loss. Typically, there's still a larger population of patients that have a more, moderate to severe loss in certain hearing regions. So they're not appropriate for everybody, but people think that will be available to them. It's always best to get your hearing tested by a hearing care professional, such as an audiologist, which is what I am.
How often should you get your hearing tested?
You should get your hearing tested annually, just like your eyes, like you get an eye exam every year or a physical every year, you should have your hearing tested every year.
Yeah.
And then, it's good to establish a baseline. You may have some hearing loss and not be quite ready for hearing aids, but then you have a record of where you're at, and then you can, as the years go on, you can kind of keep an eye on that and then see if there's something that you need to do eventually or in the future, near future, depending on what kind of trouble you're having.
Sure. Hearing aids have changed, through the years too. They used to be, people would say, I don't like them, I hear too much. But that's not to say anymore, because you can tailor them for what they want to hear, right? How they can hear.
Right, and I think, what happens too is typically people wait, about 7 years before they get hearing aids. So when they say they're hearing too much, it's because they are used to not hearing certain things. But there's a lot of adjustments that can be made. The technology has really improved. Several of the manufacturers have come out with new technology that's better for speech and noise environments, so that's what they're really working on now. And I'm offering like the latest technology that's available through the manufacturers. I'm a multi-line dealer, so I handle all the major manufacturers. So if somebody prefers a certain manufacturer over another, I have an account with all the manufacturers. But there's a lot of good technology out there. And then if you are tech savvy, the Bluetooth, streaming, there's all kinds of things you can do with hearing aids now.
So it's not just a hearing aid you put in. You can do all kinds of stuff with it, right?
That's correct.
Right.
And you have control. So if you do happen to have a smartphone, they're app-based. There's free apps that you can use to adjust your hearing aids, not just volume, but changing programs. And they actually also allow you to do some type of adjustment to like the low and mid and high frequencies. So it allows people to kind of fine-tune them a little bit better for their preferences, depending on the app they're using.
If someone's interested, or maybe they have a loved one that the TV's cranking now, they
Right.
want to get them in for a test, or maybe themselves, how can they do that?
They just give us a call. Our local number, 419-562-0707. We accept all major insurance. I'm also a Medicaid provider, CareSource, Molina. And we get people in fairly quickly, and then we verify their benefits. So they don't necessarily need to know. It does help if they are aware if they have a benefit, but we can verify benefits for them as well.
So just like you would go get your physical or your checkup every year, your eyes checked every year, you should go get your hearing checked every year too, right?
That's correct. Yep.
All right. Sonya, thank you so much.
Thanks, Randy. Happy New Year. It's nice to see you again.
Same here. Thank you.